welcome to all attendees to this special session about the power of films and virtual reality for health education and health promotion. This topic is really at the heart of the Health for All Film Festival that the World Health Organization has launched 2 years ago. And really, it's part of the DNA of this film festival to promote health and to find everywhere in the world some films which could be educative about health, and to encourage filmmakers and NGOs and health workers to produce their films. That's why it's part of the DNA, because it's not only for filmmakers, it's a festival open to health workers, to communities of scientists, to students, to universities, and so on. So really, let's hope that this session is going to highlight how the film festival can be used for health education and health promotion. And to speak about that, I have with me 3 panelists. So I have with me Anita Abada from Nigeria, a filmmaker and producer. Anita, would you say a couple of words about what you expect from this dialogue today?
Anita, hi, everyone. My name is Anita Abada. I'm a filmmaker from Nigeria, a producer and director, and I'm the director of Efun Flesh. And I'm hopeful that at the end of this panel discussion, we'll understand better how film can be a tool for promotion of health education among youth and among people. Thank you.
Thanks a lot, Anita. And we're going to see your film, Efun, that you name Flesh, Efun/Flesh. We are going to see your film in a couple of minutes. Before you would explain to us how you have used this film for health education in Nigeria. Now, we have another panelist with us from the Netherlands, Joyce Browne. I don't know if I should pronounce your name Browne. Could you introduce yourself and give us also your expectation from this discussion?
Sure, thank you. And it's fantastic to be here. My name is Joyce Browne. I'm a medical doctor and epidemiologist by training and assistant professor of global health and epidemiology at University Medical Center Utrecht in the Netherlands. And I've been using film in a lot of the global health education I'm involved in on bachelor, master's and postgrad level. And that's really what I hope we can discuss during this session, and what we take out of it is how can we use the power of film in our classrooms to engage students and to improve their level of knowledge, but also understanding of the topics that we want to inform them about.
Thanks, Joyce, for being with us. And I have to say that we have been in touch, you and me, for the past 2 years, because since the first edition of the Health for All Film Festival, we had the chance to be in touch with you, since you have also the the Dutch Global Health Film Festival in the Netherlands. And we have been in touch, and now I'm glad that we come to a concrete exchange in this session. And I have with me a representative of the WHO Academy, David Chandross from Canada. You are a professor at university as well, and you are also a game design specialist. So would you please give you a few words about yourself?
Yes, I'm David Chandross. I'm the lead for the game design unit at the World Health Organization Learning Academy. This unit is under a larger unit called a simulation unit, in which we're using augmented and virtual reality for mass casualty management training, using very state-of-the-art kind of data collection techniques. And I also teach in the Faculty of Digital Media at Ryerson University and do research in this area. And I'll be speaking about what does the future of film look like as it relates to health? How much will we be a part of the movie and not just observers of the movie? Great to be here.
Thank you, David, for this introduction. Now, let's start with Anita Abada from Nigeria. She won the Health Education Film Prize in our Health for All Film Festival in 2021. So congratulations again, Anita, to you. Before we give you the floor, we are going to watch your film, Efun.
EA says every girl must pass through this rite to become a woman. It is tradition, and girls who go through it are clean, beautiful, and become real women.
It is time.
Can I play with them just once more?
No, you are no longer like them. Today, you become a woman.
I don't want to do this.
You don't have a choice. Don't worry, you won't see it.
The last time EA prepared someone for this right, it was my sister, Osayi. I remember Osayi telling me what it is like. She said it is like a journey to hell and back, even though none of us has been there before. A part of her was cut away. She never got better. She died. EA said it is God's will.
They'll be here soon, okay? Don't worry, it will be quick.
I don't want to be like Osayi. What if I have a choice?
You know, choice isn't one of the luxuries of every woman.
I want to be a woman, but I also want to be able to make choices.
So Anita, why did you choose this topic of FGM? Why did you choose to make a fiction movie from that instead of a documentary in your country, in Nigeria? And what are you doing with this film for educating girls and mothers in Nigeria?
Thank you so much for that question. And Joyce, thank you so much for playing that film. I actually get the same feeling, the same emotions every time I see the short film. It feels like I'm seeing it for the first time again. And I decided to do a film on FGM because in Nigeria, where I come from, female genital mutilation is very common. You see children being caught, and most of them grow up having some kind of psychological, physical health issues when they become adults. And all of this is traced back to the fact that they were caught as kids. So I realized that this is a topic that I feel that we should talk about. As a young girl in my society, I was almost caught actually as a child, but my parents were actually there to ensure that it didn't happen, because in my community in South Nigeria, it's a very common practice, both as kids and as teenagers, girls are caught. But my parents decided that for no reason would their own daughters go through the same process that has caused so much physical, mental, psychological issues to other children. So I felt like putting this out there, making a film that could educate children, educate parents, to know that even as parents, you can stand for the right of your children. We're in a society where a lot of kids do not even have a say over what they can do or what they can't do. But as parents, if we can actually stand up for the kids, it's going to go a long way to curb such kind of issues in the society. As kids also, kids can make decisions on what they feel is right. And they can only do that if they are educated. And it's why I had to make my major character a young girl who was just going into adulthood, and in our society, she had to go through female genital mutilation. And a lot of people believe that film is just for entertainment basis. You just want to watch films and laugh and be happy at the end of the day. Yeah, there is the happy ending sometimes, but we also cannot rule out the fact that in a lot of situations, there are sad endings to issues in the society. And the more we keep keeping these issues or sweeping them under the carpet, the more we limit the number of people we can reach with the message of such kind of issues like female genital mutilation. So I felt like making a fiction film on female genital mutilation would get across to more people. And since it's a fiction, a lot of people enjoy watching fiction compared to watching documentaries, because people think, oh, documentaries are just for educational purposes only, just to teach, and sometimes it can get boring. Some people believe that. So I felt like as a fiction film, it will be more endearing to people to watch this film and realize that the film is not just a fiction film. It draws from real life activities. It draws from real situations of people that have gone through this kind of practice. And the earlier we realize that we can actually put a stop to it as young people, as parents, as health practitioners, the better for us. And so far, I screened the film to communities here in Nigeria. When it first screened at the Health for All Film Festival, I realized that the people who really practice this female genital mutilation are in rural communities. And the film screened on YouTube, is screened at the festival. It's not reaching the people I feel like it should reach, which are the people that stay in the rural communities. So I felt the need to actually take it to these people in these communities. And I visited Osun State in Nigeria in school, and most children even spend more time in school with their teachers than even with parents. So I felt the need to screen this to teachers, to screen this to parents, to principals, to community leaders, which is very important because community leaders are at the fore of every decision being made in societies. And if community leaders are educated on the right things to do, they can educate the other women and people in the community and put a stop to such kind of practices in the community. So I screened it to the Ballet of Iraq Beji community, and it was well received because it could attest to the fact that there's been a lot of cases of women that have gone through female genital mutilation, even in that community. And a lot of them are even going through some kind of issues that they later found out as adults that it was based on the fact that they went through this practice as a child. That's why it's happening to them. So I feel the need to put this message out to people in schools, in communities, to ensure that there's an eradication of such kind of practice.
Thank you very much, Anita, for this very clear explanation about why you made the film, how you use it with communities and schools for creating awareness on FGM and on the rights of girls to stand up, or mothers and parents to stand up for their girls against this practice. We go for the film Stressed, a Pandemic of Fear, which is also a winner from the 2021 edition of the Health for All Film Festival. It was the winner of the Grand Prix for the category on health emergencies. It's a film about the stress of COVID in refugee camps. And again, it's about children. It's not because we want this session to be about education for children. Just by chance, we have two films now about children.
So the United Nations says that there's a high prevalence of mental distress worldwide because of the coronavirus pandemic, especially amongst healthcare workers, as you would expect, and children as well.
The United Nations is asking governments that as the pandemic crisis drags on, not to forget about the mental health toll that this is having on many. With all the changes happening as we overcome this pandemic, it's easy to feel overwhelmed, anxious, and stressed. So joining us now is board-certified psychiatrist Dr.
When you are in a dangerous situation, stress and fear is actually guiding us and helping us to get out of the situation. So it's helpful. However, and there is a big however here, because you can have something called toxic stress. This is when the stress is not longer tolerable and you cannot relax after it. So it becomes more chronic and more permanent. It's all about the starting point. If you are a child living in a refugee camp because you have been living for years in a war that you managed to escape from. You're not ready to deal with COVID. You don't have the capacity, you don't have the energy because of your prior traumas. So this is a huge challenge, making these children very vulnerable in this situation.
أول ما سمعنا إنه في كورونا خفنا كثير، لأنه خايفين إنه يجي حدا من برا يعدينا، يعني خفنا كثير، خايفين عليهم إذا حدا انصاب من عائلتي يعني. شو تتوقعين النهاية هذا المرض؟ نهايته يعني ما أدري العيش.
Children are sitting in the camp believing they are going to die. We have to talk with children directly. We have to address COVID-19 directly with them and ask them how they are doing.
يعني نروح أنا وأصحابي المدرسة قبل فيروس كورونا ونلعب وذا، ما نحناش خايفين من فيروس كورونا ذا، وما جا فيروس كورونا يعني احنا خفنا منه. غلق منه سريع الانتشار، يعني يخبون احنا داخل البيت ما يشتون حاش نخرج بسبب فيروس كورونا، ما يشتوش يخسرون احنا.
I would say that my biggest concern in this situation is that it will be very hard to get all children back to school. And if we cannot get these refugees back to school, they will suffer for the rest of their lives.
So Joyce, you have also 3 minutes to tell us about your experience with students in the Netherlands using the winning films of the film festival of this year particularly. How did you use that for contributing to health education of students, and what type of students were concerned by your experience?
Thank you. So what is important about film is that they inspire change. And that's not a new thing that I now come up with. It's actually the slogan of the Global Health Film Initiative in London. And I think it captures so well what film brings us and why it is such a valuable addition to the classroom and any health education setting. Film adds a layer of awareness, of empathy, of understanding that goes beyond what dry text can do or what information leaflets can do. And it actually pulls in a very classic thinking of rhetorics in that you need logos, ethos, and pathos. So this adds the story, the emotion, the empathy next to the credibility and the expertise that also goes into, and all the research that goes into making a good story. And that's also, Anita, what I really appreciate about what you shared. It requires a lot of background understanding to create a good narrative and the choices that will lead to the final product. And if you do this right, what we saw now on two occasions, you have something that moves students and that trigger them to be interested, to wanting to learn more. So that's really how we're using it. So we've used these films in a course for bachelor students in a course called Global Health, Environmental Health, and Climate Change. So one of the nice things about films is that it spans so many topics. And in this case, we use film and the concept of health equity. And we just asked students to go through the list of nominees of the WHO Film Festival of last year, watch them all, select the top 3, and then in smaller groups talk to each other, have a conversation about what they saw, how they felt also on this emotional level, but also what other questions they would like to explore with the teachers involved. And in this way, it was a really good experience because we provided students with another way to engage with the content and the theoretical material. And it resonated very well with them because it connects on so many levels.
Before David, you would speak, Dr. Krech, he has to leave us in not too long, maybe 5 minutes. You have with us still more. So before he would go to another session, as director of the health promotion department in WHO, and as I would say the boss of this global conference, organizing all this is a big challenge for you and your team. So Dr. Krech, would you tell us about this global conference on health promotion? How the aspect of films and educative films is useful for the conference itself, for your network?
In health promotion, we are looking at how to improve people's ability to take control over their health. That is actually the definition of health promotion. And so everything we do, we try to improve this ability to make a healthy choice, to be informed about what actually makes us healthy, what makes us unhealthy, and take an informed decision. And of course, that you cannot do alone, but you can only do this within the environment in which you live. And obviously, that there's huge inequities in the environments in which we live. So the ability of taking control over our health is quite different in different living contexts. And so therefore, if you ask me about how do we use films in this conference, and how do we use films in health promotion, it is actually to address different parts of our understanding. So as I said before, it's not just the pure information about health facts. That will not drive our behavior. What drives our behavior much more is the health literacy. And that is that not only we receive information, but we translate this information into our own life environments. And then once we have translated this into our own environments, then we still need to make a next step to appreciate and then say, how will I react to this environment and this knowledge now that I have over a certain, over a certain health issue, right? So for instance, if I know that tobacco kills 8 million people a year, I take it as a news, but it doesn't really affect me. If I then see that every second person who smokes dies, and I have a friend who dies of tobacco, then I might actually do something different. And so what it is this feeling, and that's exactly the same as if what you're doing. You're creating films that create emotions, and these emotions, if they are so close to my own living environment, that means that I then really can make a difference in my behavior. And that is how we use films, always based on the evidence, so that we're not trying to do something which is outside of health facts, but to translate those health facts into our environment so that it's attached with emotions. And that is what health literacy is all about, these 3 steps. And that's why we use a lot of films. If you watch the conference, you will see, for instance, why we now need to move, why we now need to drastically change our societies. And we do this with the help of a young person whose future is dependent on whether or not we are able to make the move, whether we are now rebooting our society so that it's not just to build back, that's not good enough. Build back better, not good enough. We need to build forward stronger societies that actually are aware of or make aware of health risks and actually put the people's well-being in the center of economies, of social development, and of course of governance. And therefore, that is how we are using films, and that is why your contribution, colleagues, is so important to us, because we also learn from that, you know, how to tell stories that touch people's minds and souls. Thank you.
Thanks a lot, Rüdiger, for this. I hope you can stay a little more. We are going to have David. Maybe you have to go for the next session.
I'm so very sorry.
That's so kind that you join us and you gave this important message.
It was a real pleasure for me and really important to me to be with you, because I think that having started this film festival, Jill, thank you for this, and thank you very much also, because it's people here in WHO that make the change. So it's not the policies only, but it's the people who make that change, and together with you, who actually then send in your contributions to the Health Film Festival. And I hope that you know, being on the panel to look at them has been a real fantastic experience, and I hope that many more of the colleagues will join. Thank you very much for today.
Thanks a lot, Rüdiger. So we are going to have now the testimony, sharing of experience from David Chandross from Canada. Just before we go for that, one sentence. Dr. Rüdiger Krech mentioned that behavior change, and I think David is really going to speak about that, I'm sure. Behavior change is key in the ultimate goal of education we do, health education and health promotion. And Dr. Krech mentioned that people's well-being should be at the center of everything in terms of policy change, the research from WHO, the research from scientists, and of course the work of health workers, the work of different actors in the health sector. So we have in the film festival a category for that, for the well-being. So it's about everything which is not purely medical treatment or medical care. It's really social determinants of health, environmental issues, etc. So David Chandross from Canada, please. We have, you're representing the WHO Academy. Do we have a chance to play the video of the WHO Academy?
D'ici 2030, 350 millions d'entre nous travailleront à améliorer la santé dans le monde entier. Nous devons être capables d'apprendre tout au long de notre vie personnelle et professionnelle pour atteindre cet objectif. L'Académie de l'OMS combine la science de l'apprentissage destinée aux adultes et des technologies innovantes pour concevoir des formations en matière de santé fondées sur des données probantes. Notre campus ultramoderne, situé à Lyon, sera à la pointe de l'apprentissage interactif et immersif. Et notre plateforme numérique en accès libre offrira à un réseau mondial d'apprenants des expériences d'apprentissage personnalisées et des titres de compétences numériques vérifiables. Les programmes de formation de l'Académie de l'OMS sont conçus par et pour les agents de santé et auxiliaires de vie, les responsables des politiques, ainsi que le personnel de l'OMS et de l'ONU. Ces formations autonomes, multilingues et compatibles avec les connexions à faible bande passante vous permettront de contribuer à un monde plus sûr et en meilleure santé, où que vous soyez, et quels que soient les défis auxquels vous êtes confrontés.
Okay, David. So that was the presentation of the WHO Academy, in which we saw a few examples of virtual reality, a bit of examples of technology. It was quite short in the... Can you please give us your experience as game designer and also advisor to the WHO Academy, please?
New digital media is going to be with us and is with us in many ways now. Filmmaking, as we've understood it here, is a relatively passive experience. There is emotional activation. And that's key, we're going to follow up on. But we're moving into a point of digital media where you're going to have some important changes in technology which are going to drive it. One of these is the area of mass casualty management. And what our team has been doing for the past year is assembled some of the best experts in augmented reality in the world. And we are now able to take a simple stick about this size, like a LIDAR stick. I have my game background here. And this LIDAR stick is able to walk through, we can walk through any emergency room anywhere in the world, Ethiopia, Portugal, you name it, Sudan. And in a couple of minutes, have a complete representation of that emergency room, that now the members of the emergency response team can all put on AR goggles, see their emergency room and the table in front of them. And then we've developed computer simulation for every kind of disaster you could imagine. And the basic data is that what you do in the first few minutes following a mass casualty incident determines the rest of your life. So these emergency response teams are going to be able to rehearse how they will handle a Beirut, a Lebanon explosion, or any of these events we see in Iraq and Iran, these suicide bombs or things like this, and be able to plan that response using a digital version and add any elements that they wish to it. Digital media will become more interactive. I call it Alice through the looking glass. That is that you have this reality, but you have other realities, which are imagined realities. So some of the work we're doing in the area of what's called gamification is we've developed some very interesting models for looking at how we add game elements to every course here going forward from the Academy. And what we know from the incredible literature in video game design is that we have not been engaging in the form of standard education, PowerPoints, lectures, quizzes, labs. A lot of that time really goes to naught because the recall of weeks later, we know in studies, is really low. If you become interactive, then the game elements will activate parts of the brain that will facilitate recall. I'll state one short of example of how that works, and we can maybe use it as a springboard. We know that in game conditions, there's two parts of the brain that are activated, are involved. One is called the default mode network, and one is called the ventral striatum. So the default mode network is if you're driving down the highway and you're thinking about what you want for dinner, you're still driving, but you're not mindful, you're not focused. Game conditions, when compared to self-study and other conditions for learning, were the only ones that were able to focus the mind. So in the future of filmmaking for health, we have the ability to actually become a patient. We have an ability to change the perspective we're seeing. If I look at Anita's film, in virtual reality, you become that girl and you have some agency. Perhaps in your version of it, you're able to fight them off and push back. And then there's this discussion of, well, we shouldn't have fantasy, we should have reality. But it turns out that the research on narrative and fantasy primes learning for reality. So films don't have to be documentary photographs of something in order for them to be impactful. You can take a movie like Lord of the Rings or another fictional piece and learn profound messages about what it is to be human. I'll conclude by saying a good deal of the work that I do across the world with respect to this now is finding ways to have every course have game elements. And we have a tool, which if we have time, I'll show it to you in a second later. But we have a tool now so that every course is going to be designed by a subject matter expert, goes to the learning designer. It then comes to the game design unit, and you have to assign game elements to that course to get it through. There's no more PowerPoint with quizzes. It just doesn't work. And we're spending a lot of money on things that don't work. What does work is if I can be in my job in virtual space, practice it enough, integrate some of the real world, at the end of it, we say, okay, you managed not to hurt the last 100 virtual patients you saw, you might be ready for the real world. And closer, this simulation, the last comment I would make is that where we're going in this is haptic vests, computational fabrics. You can wear clothing that computes now, computational fabrics. We also know that we can use haptic outfits. That means that every gesture that you make, whether you're suturing a wound or admitting patients, can all be registered in virtual space. And this allows for incredible things like nonlinear narrative, where you have one story and you can choose your own adventure and choose which story or outcome you want to be exposed to. And this kind of training and virtualization has the great advantage that it uses play. And I know the word play and mass casualty management with children after an IED don't sound like they'd be in the same sentence. But believe it or not, humans are made to play. And when we are refreshed by learning content, engaged and excited about learning, the recall is improved about 60–70%. I'd leave it there, and hopefully our discussion can move forward from this point.
Yeah, thank you, David. Thanks a lot. In fact, indeed, I see the time is running so fast. In fact, we should now conclude. I was hoping we would have enough time to dialogue between themselves, but I'm sorry, it's not going to be possible. It means we should meet again. We should continue maybe this panel discussion in a second phase another time. I hope we could do that. So for the conclusion, I propose. So first, thank you, David, that you named, for instance, the example about game design and virtual reality. You mentioned the example of Anita's film, saying that the girl she has staged in this role of a girl saying no to her mother about FGM. So it's already, in a fiction movie approach, to me, it's already a way for the audience concerned to give a projection and to imagine they could be this girl, or they could be the mother, or they could be the father in charge of this girl. And that's the power of fiction movies, of course. But you're adding that this could be a game, and that then, instead of imagining, then the player of a game could really experiment the situation and be in place of a girl. So that's a good linkage between your two interventions. I would love to make so many more linkages between your different experiences. I will need 2 minutes to conclude. We have 2 questions from, I don't know if Lorena, we had 2 questions from the audience, or 2 or 3 you selected, but I'm not sure we have time. Could you just read them? I'm not sure we have time to answer them, but we are going to answer that in different ways.
Yes, the first one is for Anita. Anita, people would like to know from your experience showing the film in rural communities, do you find that using fiction encourages conversation and debate more than traditional educational films? Another question is in terms of virtual reality, David. They are interested on knowing resources for health promotion on virtual reality.
Okay, so that's also, I suppose, David, I hope you could help, and we could try to find some other sources to advise this person. So I would like to thank a lot my panelists here, Anita Abada, Joyce Browne, and David Chandross. Thank you for your testimonies. We have spoken about so many things we could explore more, whether it's about the types of film, the comparison we have done a little bit between fictions, documentaries, animation, game. We could certainly go further in the discussion about that. We have also spoken about different target groups. Joyce mentioned what she did with students, how students watching different films can then discuss together about which film is more appealing for one or the other. So this is another way to use films for health education and in the curriculum of students in universities. We have spoken about the importance of combining emotions and information in a film, whether it's interactive, whether it's fiction, whether it's a documentary, whichever type. Combining emotions and information is really the way to make sure the people will memorize the information because it's linked to an emotion. And Rüdiger Krech, Dr. Krech mentioned that it's not enough to give an information. We want to reach behavior change, of course, and we want this to be proven, scientifically proven, because the WHO is always based on evidence, scientific evidence. So the WHO has developed, and we could speak about that as well, the behavioral insights approach. And we are more and more studying how the change of behaviors can be scientifically assessed. And certainly filmmaking, narration, storytelling could benefit from that and could be a contribution to that as well. So I think I should say goodbye to everybody already. Goodbye to all attendees. Many thanks for your presence with us. And goodbye, Anita Abada from Nigeria, Joyce Browne from the Netherlands, and David Chandross from Canada. I'm really glad that you were with us to share your experience. And let's think about a follow-up session to organize one day, if you're okay with that.
All right, goodbye. Thank you.
Au revoir.